A shocking revelation has emerged from a recent study, challenging our understanding of a deadly fungal lung infection. Pneumocystis pneumonia, PCP, a severe condition, is no longer confined to its traditional high-risk groups, and this shift has profound implications for healthcare. For years, PCP was associated with specific patient profiles, those on immune-suppressing drugs or with blood cancers. However, a 7-year study from Taiwan has uncovered a disturbing trend. Dr. Ting-Wei Kao and his team analyzed 470 non-HIV PCP patients, and their findings are eye-opening. The study, published in the Journal of Infection, reveals a dramatic shift in the demographics of PCP. By 2023, nearly 70% of cases were in patients not fitting the traditional high-risk categories. A fundamental change is underway, the researchers emphasize. Elderly patients are particularly at risk, with over a third of those aged 85 and older developing PCP despite not taking the usual high-risk medications. But here's where it gets controversial. Solid cancers have now surpassed blood cancers as the most common underlying condition in PCP patients. And this is the part most people miss. Nearly one-third of patients had no previously identified risk factors at all. These patients were older, with common health issues like high blood pressure and diabetes. The outcomes are concerning. Patients with solid cancers face the worst prognosis, with hospital death rates exceeding 60%. Overall, half of the patients died during hospitalization, and the disease was severe across all groups, with most requiring intensive care. Current prevention guidelines focus on high-risk medications, but this study suggests we're missing the mark. The researchers found varied medication patterns across different diseases, indicating a need for more tailored prevention strategies. The increasing number of cases in elderly patients with multiple health conditions suggests that aging and common medical issues create a unique vulnerability. These findings have immediate practical applications. Doctors must be vigilant for PCP in broader patient populations, especially elderly patients with solid cancers and multiple health conditions, even if they're not on traditional high-risk treatments. More sophisticated risk assessment tools are needed, considering age, overall health, and disease-specific factors. Professor Youngyan Qian, the study's corresponding author, emphasizes, the evolving patterns suggest that current prophylaxis guidelines may need an overhaul. We're failing to protect a significant portion of vulnerable patients, particularly those with solid cancers and elderly individuals with multiple comorbidities. Targeted prophylaxis strategies are crucial to prevent this deadly infection without unnecessary antimicrobial exposure. What are your thoughts on this evolving healthcare challenge? Share your insights, and let's spark a conversation on this critical topic.